Have you ever felt like you're caught in the middle of a family feud you didn't start? Or seen a parent try to turn a child against the other? This can be incredibly confusing and painful, and sometimes it's linked to deeper psychological patterns. Today, we're diving into a sensitive but crucial topic: the connection between antisocial personality disorder, or ASPD, and parental alienation. We'll explore how these two issues can overlap, the profound impact on children, and most importantly, what can be done to protect them and start the healing process. This isn't just about understanding a problem, it's about finding solutions and hope for families navigating these difficult waters. So what exactly is antisocial personality disorder? It's more than just being antisocial in the everyday sense. ASPD is a mental health condition characterized by a long-term pattern of disregarding or violating the rights of others. Think of traits like manipulation, impulsivity, frequent deceitfulness, and a striking lack of remorse or guilt. It's estimated that about 1 to 4% of adults might meet the criteria for ASPD. For many, this isn't something that appears out of nowhere. A significant number of individuals diagnosed with ASPD have a history of childhood neglect or abuse, which tragically shapes their adult behaviors and how they interact with the world, including their own families. Now let's talk about parental alienation. This is a process where one parent systematically undermines the child's relationship with the other parent. It often happens before, during, or after a separation or divorce, and studies suggest around 15% of separated parents experience it to some degree. It's not just a single argument, it's a campaign. This can look like one parent constantly making negative comments about the other, creating distrust, or even forming an exclusive alliance with the child, making them feel like they have to choose a side. The effects on the child are devastating. They can experience intense emotional distress, confusion, anxiety, and it can set them up for long-term relationship difficulties. So how do these two concepts, ASPD and parental alienation, connect? The traits common in ASPD can act like fuel for alienating behaviors. Let's break it down. First, manipulation and control. Someone with ASPD may be naturally inclined to manipulate situations to their advantage. In a family context, this can translate into a calculated effort to influence a child's loyalty, painting the other parent as incompetent or unloving. They might try to control the narrative, creating conflict and confusion for everyone involved, especially the child. Next, there's the lack of empathy. A parent with ASPD might struggle to see things from their child's perspective. They may genuinely not understand or even care about the emotional turmoil their actions are causing. Their own needs and desires, like winning the child's loyalty or hurting their ex-partner, can take complete priority. This lack of empathy makes it very easy for them to overlook the child's fundamental need for a healthy relationship with both parents, which worsens the alienation. Then there's a pattern of idealization and devaluation. A person with ASPD might swing between portraying the other parent as all good or all bad. This creates a very unstable environment for a child. One day, the other parent is the best in the world. The next, they're the villain. This emotional roller coaster is incredibly destabilizing for a child's perception of their family and their own emotional security. It forces them to live in a black and white world where love and loyalty are conditional and constantly shifting. The impact on children caught in this dynamic is severe and can be long-lasting. When parental alienation is amplified by ASPD-like traits, the risks multiply. Let's talk about the emotional distress. These children are far more likely to experience chronic anxiety, sadness, and a deep-seated confusion. They often feel trapped, believing they have to betray one parent to be loyal to the other. This internal conflict is a heavy burden for any child to carry. Beyond the immediate pain, there are long-term consequences for their relationships. Research suggests that around 30% of children affected by severe parental alienation struggle with their own romantic and social relationships as adults. They may have trouble trusting others, develop a deep fear of abandonment, or unconsciously repeat the dysfunctional patterns they grew up with. It's a cycle that can be very difficult to break. Perhaps one of the most concerning outcomes is the risk of children adopting ASPD-like traits themselves. When a child sees manipulation or emotional detachment being used as a successful coping strategy by a parent, they might learn to use these tactics too. It becomes their survival mechanism. Over time, these learned behaviors can become ingrained, potentially carrying into their own adult personality and relationships. This is how intergenerational trauma continues. But it's not a hopeless situation. There are concrete strategies that can be used to reduce the harm and protect the child. Sometimes legal steps are necessary. This isn't about punishment, it's about protection. Formal interventions like court-ordered parenting plans or custody arrangements can enforce clear boundaries and uphold the targeted parent's rights. This can limit the alienating parent's ability to exert undue influence and create a more stable structure for the child. Alongside legal measures, therapy and mental health support are absolutely critical. Family therapy can help improve communication and rebuild fractured relationships in a safe, mediated environment. Individual counseling can give the targeted parent tools to cope with the stress and respond constructively. And most importantly, child-focused services are essential. A therapist specializing in these issues can help a child process their confusion, navigate loyalty conflicts, and deal with their emotional distress. Studies have shown that the right therapeutic interventions can improve family functioning by up to 50%. So, when should you seek professional help for a child you're worried about? Keep an eye out for warning signs. Are you seeing significant changes in their mood or behavior? Maybe they've become withdrawn from friends and activities they used to love. Are they showing heightened anxiety or a new, unexplained fear? Perhaps they're having trouble forming new friendships or seem emotionally disconnected. These are all red flags that a child is struggling. A child specialist can provide a safe space for them to talk about their feelings without fear of judgment or taking sides, helping them untangle the confusing messages they're receiving. In conclusion, understanding the overlap between antisocial personality disorder and parental alienation is the first step toward breaking a destructive cycle. It gives us the language to identify harmful behaviors and shines a light on the underlying dynamics that can make family separations so toxic. By bringing awareness to this issue, we can help families recognize what's happening sooner. With the right support, professional intervention, and a focus on the child's well-being, families can move toward healthier dynamics. It takes a lot of patience, knowledge, and consistent effort, but healing and reconnection are possible. The goal is always to restore a child's right to a loving relationship with both parents and to help them build a foundation for a healthy, happy future. Thank you so much for watching and for taking the time to learn about this important topic. If this video was helpful, please give it a like and consider subscribing for more content on mental health and family dynamics. Sharing this video could help another family in need. Take care.